Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's April 2020 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice is an original article entitled Relationship Between Organizational Leadership and Healthcare Employee Burnout and Satisfaction. This article is authored by Dr. Lottie Derby and colleagues from Mayo Clinic in Rochester, Minnesota and Jacksonville, Florida. In their delivery of healthcare organizations are founded upon cross-sectional teamwork that brings together individuals with diverse healthcare expertise and responsibilities. Healthcare organizations are also hierarchical, as individuals in a given work unit are answerable to an ascending managerial structure with supervisors appointed at various levels. The interaction between supervisor and supervisee is a critical one because it integrates levels of organization. It serves as a bidirectional conduit for both top-down and bottom-up communication. It evaluates work-related performance and expectations, and it provides an opportunity for an employee to dialogue with supervisory staff, to discuss challenges encountered, and to explore career opportunities and aspirations. This interaction is also a substantial determinant of staff satisfaction and the lack thereof manifested as burnout. For example, in studies published 5 years ago in Mayo Clinic Proceedings, Schanefeld et al. Demonstrated an association between physician satisfaction and burnout with organizational leadership. In their survey involving more than 2,800 physicians, the likelihood of satisfaction increased by 9% and that of burnout decreased by 3% for each 1-point increase in relevant composite physician leadership score. 2 years later, in presenting organizational strategies to promote physician satisfaction and reduce burnout, Schanefeld and Noseworthy underscored the importance of this association by listing and discussing Harness the Power of Leadership as the second of their 9 strategies. In the present issue of Mayo Clinic Proceedings, Derby et al. Addressed this issue for non-physician healthcare employees in a survey in which some 40,000 employees responded, representing a 70% response rate. Leadership was assessed by a modified Mayo Clinic leadership score in which 8 aspects of leadership and 1 composite score were evaluated by the employee. Satisfaction was evaluated by a single targeted question regarding contentment with Mayo Clinic with a 5-point response scale. Burnout was assessed by 2 items from the Mashlack Burnout Inventory, each with a 7-point scale. The data demonstrate that satisfaction and burnout correlated with the 8 specific aspects of leadership as well as the composite leadership score. Notably, the likelihood of satisfaction increased by 11% and burnout decreased by 7% for each 1-point increase in relevant leadership score. Other significant findings in this study included the fact that satisfaction was less likely and burnout more likely in employees who were either younger or had longer service, and that the job category significantly influenced the level of satisfaction and burnout. As pointed out by the authors, younger employees may have greater difficulty in integrating responsibilities of their professional life with familial responsibilities and other aspects of their personal life. And employees with longer service may experience greater difficulty in adapting to the ever-changing landscape in the workplace, or may have long unfulfilled professional aspirations. The importance of the study by Derby et al. Is that it underscores the care and discernment institutions must exercise when selecting supervisors and leaders, because their leadership skills and behavior influence employee satisfaction and burnout, and it emphasizes that organizational strategies intended to improve satisfaction and reduce burnout in employees have to be cognizant and accommodate the modulatory effects of such factors as age, duration of service, and job category. Our first highlight article is an original article entitled Characterization of Acute Prescription Migraine Medication Use, Results from the Cameo Study. This article is authored by Dr. Susan Hutchinson and colleagues from Orange County Migraine and Headache Center in Irvine, California, Albert Einstein College of Medicine in the Bronx, New York, MedStar Georgetown University Hospital in Washington, D.C., Vedanta Research in Chapel Hill, North Carolina, and Allergen PLC in Irvine, California. On an individual level, migraine can cause recurrent suffering that is inestimable. On a national and worldwide level, migraine is a relatively common disease that afflicts 10 to 15% of these populations, ranks among diseases that impose the longest duration of disability during a patient's lifetime, and exacts substantial and long-term healthcare costs. Migraine's burden of illness has the potential for far-ranging adverse effects on one's personal, familial, and professional life. In a prior study in Mayo Clinic Proceedings, for example, Bussey et al. Reported that individuals with migraine had diminished involvement in family activities, significant misgivings regarding their parenting ability, and persisting feelings of financial insecurity for themselves and their families, all because of their personal affliction with migraine. Migraine is heterogeneous in its frequency, severity, duration of acute attacks, and attendant symptoms and conditions. And this thus raises the question as to how do individual sufferers of migraine bear the burden of their disease. This issue is addressed specifically as regards the use of acute prescription medications by Hutchinson et al. In the present issue of Mayo Clinic Proceedings. The authors analyzed data from the Chronic Migraine Epidemiology and Outcome Study, the Cameo study, an internet-based self-reporting cross-sectional study that compiled information on the demographics, clinical course, disabilities, and comorbid conditions associated with migraine. This study also undertook longitudinal surveys at intervals of 3 months. Patient-reported outcomes including the Migraine Disability Assessment, the Migraine Symptom Severity Scale score, and the Migraine-Specific Quality of Life Questionnaire. The data demonstrate that of the 13,624 respondents, those who never used acute prescription medications for migraine, namely 64.5%, far outnumbered those that did at 22.9%, with 12.6% of the respondents being discontinued users. Current users, who tended to be older and female, exhibited the highest monthly frequency of headaches, more than 7 days, the highest degree of migraine symptom severity, the worst migraine-related disability, and the highest prevalence of anxiety and depression as assessed by targeted questionnaires. Of the medications used by current users, approximately 50% involve triptans, with lower frequency of use involving opioids and non-steroidal anti-inflammatory agents, and even less still of barbiturates. Only 2.1% of respondents reported the use of ergot derivatives. Individuals who never used prescription medicines tended to be younger and male, and had less severe disease and disability. Yet even in this subgroup, almost 30% reported moderate to severe disability from migraine, and more than 10% suffered from migraine attacks at least 10 days per month. Individuals who never used prescription medicines gave as their reasons the fact that their migraine attacks were endurable with their non-prescription drug strategy and other self-treatment approaches, their concerns about side effects and costs of prescription medicines, and that they were unaware that such prescription-based medications were available. As emphasized by Hutchinson et al., inadequate treatment of acute attacks of migraine not only prolongs their duration but also predisposes to chronic migraine and attendant disability. There is thus an unmet need for better therapies for acute attacks, one that may benefit all subgroups of individuals afflicted by migraine, but especially so for the current user subgroup given their heavy burden of disease and disability. Finally, greater engagement of individuals who never use prescription medicines with healthcare professionals may aid their understanding of the range of therapeutic options, may more effectively manage their acute attacks, and may mitigate the risks of disease progression and sustained disability. Our second highlight article is the first in a series of thematic reviews on perioperative medicine. And this inaugural article is entitled Preoperative Evaluation Before Non-Cardiac Surgery. This article is authored by Dr. Dennis Mike Byerly and colleagues from the Division of General Internal Medicine at Mayo Clinic in Rochester, Minnesota. Prior to discussing this article, Mayo Clinic Proceedings wishes to thank Dr. Karen Mock for her expertise and leadership in bringing together this series of thematic reviews of salient topics in perioperative medicine. This inaugural article by Byerly et al. Centers on the first phase, namely preoperative, of the triphasic field, namely preoperative, operative, and postoperative, of perioperative medicine, specifically addressing preoperative evaluation before non-cardiac surgery and largely discussed from a perspective of the asymptomatic patient. After providing an overview of the physiology of surgical stress and anesthesia, Byerly et al. Succinctly discuss risk assessment with attention to surgical urgency and the risks that are specific for surgery, the patient, and the organ system, among others. In addition to relevant textual discussions, Byerly et al. Provide helpful, self-explanatory tables that summarize the outcomes, advantages, and limitations of assorted risk assessment calculators, a system-based approach to critical aspects of the history and physical exam in risk assessment, and the indications and role for preoperative testing in asymptomatic patients. The review discusses preoperative assessment in special patient populations, including those who are geriatric, pregnant, or obese, and in patients who've had chronic liver disease, HIV, or those that refuse blood products. In her introduction to these thematic reviews, Dr. Mark outlines the topics that will be covered by subsequent articles and underscores key considerations in perioperative medicine, including the following: the multidisciplinary nature of this dynamic field and evolving practice, the rise in surgical volumes in recent years, underpinned in part by an aging population with an increased need for surgical procedures, and yet a population with increasing medical complexity, multimorbidity, and frailty, the importance and increasing utilization of the perioperative surgical home model of care, and the emphasis in perioperative medicine on such objectives as cohesiveness of care, reducing morbidity, improving outcomes, enhancing post-surgical recovery, and decreasing the length of stay, rates for hospital readmission, and the cost of care. Assorted types of stress and their attendant diseases often occur unexpectedly, whereas the nature of the biologic stress and the medical and other risks that will be imposed by impending anesthesia and surgery become apparent during preoperative evaluation. As underscored by both articles, such evaluation, including that of risk assessment, provides a window of opportunity for formulating management and strategies aimed at risk reduction. You can access these highlights and editor's choice articles free of charge during the entire month of April when you visit our Mayo Clinic Proceeding website at www.mayoclinicproceedings.org. You will find links to our social media by clicking the buttons at the top of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Highlights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on our homepage, as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who have made a strong impact in their field of study. We have 2 new installments in this feature, facilitated by our Associate Editor, Dr. R. Scott Wright, last month with Dr. David Holmes, and this month with Dr. Bernard Gersh. You will see many news stories on our website that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content and articles published online ahead of print. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. The article concludes with 8 clinical scenarios broadly illustrating how system-based risk was assessed and disease-specific management recommendations were formulated. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.